Thank you for joining me today. In this video, I want to explain more mood disorder. Mood disorder include depression and bipolar. And mood disorder is a disturbance in emotional state. Majority of mood disorder include depression disorder and bipolar disorder. The key idea is extreme mood changes, impair function, and safety risks. So the mood disorder, it's a disturbance in an emotional state that can lead to extreme mood change and embarrass a function and safety and create risks. Depression disorder. Major depression disorder is 2 weeks or greater of a depressed mood, loss of interest. Core symptoms of depression include SIGECAPS. SIGECAPS is a abbreviation of the depression symptoms. It includes sleep disturbance, interest is low, you don't have interest of doing the activity that you enjoy. Patient feels guilty, they have a low energy and fatigue. Concentration is low, it affects the concentration. Appetite changes. Some people have increased appetite, some people have a low appetite. Some people have a psychomotor changes, suicidal ideation. So depression, it is emotional and cognitive and physical symptoms. So it has emotional symptoms, psychiatric symptoms, cognitive and physical symptoms. You want to assess the risks, include suicidal ideation. Highest priority in depression that you must assess is if they have a plan, mean, and interaction. Persistent depression is a dysrhythmia. Chronic mild depression, and the duration is 2 years or more. That's persistent depression disorder. Always sad, baseline mood. Bipolar disorder is one of the mood disorders. So bipolar has ups and downs. That's why it's bipolar. Bipolar has 2 phases. It's bipolar depression or bipolar manic. So bipolar depression is an episode that they go through alternative, and the manic is there is also hypomanic. Manic is patient have elevated mood, irritable mood. They are manic. They are faster talking. They have decreased need for sleep. They have grandiolous. They have rapid speech. They are risk takers. They have having a racing thought. Some of them are happy. They are singing. They are laughing. They are happy mood. Some of them they are. So the risks of manic is poor judgment. They have a poor judgment of risks. They are risk takers. They are impulsive behavior. They have impulsive behavior. They can require hospitalization because of their impulsive and risky behavior with the poor judgment. Hypomanic is less severe than manic. No major function impair. It lasts 4 days or more. So type of bipolar. There is a 3 type of bipolar. Bipolar I, Bipolar II, and Cyclothymia. Bipolar I is a manic episode. Bipolar II is a hypomanic with depression. Cyclothymia is the chronic mood instability. What causes the bipolar? Bipolar has many factors. It has genetic factors, neurotransmitter imbalances like serotonin, dopamine, and norepinephrine, environmental stressors that can cause the manic or the bipolar. What are the treatments? Combination treatment is the core treatment. Medication and psychotherapy are the core treatments. Medications include antidepressant medication, SSRIs, lithium and mood stabilizers, antipsychotic medication. Medications are the first treatment for stabilization of the patient. So first you will use the medication and then you will conduct the psychotherapy because you want to stabilize the patient first. Then you will use psychotherapy, cognitive therapy, interpersonal therapy, family therapy, cognitive behavior therapy. Your role as a provider is to assess the safety, medication adhesiveness, monitor the side effects, conduct psychotherapy, psychoeducation to support coping skills and teach them coping skills. Interventions include promoting nutrition, sleep, encouraging to be independently, therapeutic communication. Insomnia and manic, you want to reduce the stimuli, set limitation, and be firm, consistency. You want to ensure the safety and monitor the hydration and nutrition. Clinical differences between bipolar and major depression diagnosis versus bipolar are: depression has mood changes only. However, bipolar have a depression and manic. So bipolar have a depression phase and manic phase, but the depression don't have manic. Energy. Depression energy is low. When you are depression, energy is low. However, manic phase of bipolar energy is high. For risks, you want to assist the depression patient, mostly have a suicidal ideation, you want to assist that. However, bipolar patient with manic, they have impulsive plus the suicidal risk. Treatment for depression is antidepressant medication. Treatment for bipolar, manic, and bipolar is mood stabilizer. The key complications include suicidal ideation, behavior risk to injure themselves, especially if they are manic, medication non-adhesiveness, relapse for treatment. So, major depression, to be diagnosed with major depression requires 2 weeks or more having a depressed symptoms. Manic is decreased sleep, grandiolous, and risky behavior. Bipolar I and Bipolar II different is between being manic and hypomanic. You want to assess suicidal ideation. Mood stabilizer is the first line of treatment for bipolar patients. Never give antipsychotic medication alone in a bipolar manic patient. So depression symptoms include decreased mood, decreased energy, decreased pleasure, risky of suicidal ideation, eating and sleep changes. Some people sleep more and eat more. Some people sleep less and eat less. They are slow thinkers, and it's sadness is the main symptoms. It's not the goal, it's the main symptoms. First, mania. Mania is increased mood, happiness, more activity, but this happiness is happiness that is impulsive. This is not healthy happiness. This is a crazy happiness. It is more impulsive, more active, no sleep. Sometimes they are aggressive and agitated, risk-taking behavior. So mania is not healthy, and it is risky behavior. Mood disorders. You want to emphasize the recognition of the depression and bipolar disorder. You want to differentiate these two conditions. You want to assist the suicidal ideation and safe focus. That's what you want to be focusing on. Thank you for joining me today. I will love to see you in my next video.